Hi, Dr. Henry. So we keep getting surprised a little bit as media and people in the public with learning through social media that pharmacies suddenly have vaccine supply available. An example in Kamloops is that the BC Pharmacy Association website says that all the local vaccine clinics don't have AstraZeneca available, but we've seen today even that Walmart now has doses for the next 5 days. Shoppers has doses on Monday. And I'm just curious, Interior Health says that the Pharmacy Association is the middleman with doses administered at pharmacies. So does the Pharmacy Association need to better communicate this information? I just feel perhaps finding out about these clinics on social media maybe isn't ideal.
Yeah, and it's another one of those challenges that we have. So right now, it's the fridge-stable AstraZeneca vaccine, and that has been available through the pharmacies. And we've partnered with the pharmacies to do that, but they have to meet certain criteria. One of the most important things that I've said from the very beginning is that every single dose and every single lot number needs to be recorded in our provincial immunization registry. So not all pharmacies are connected to the immunization registry. The pharmacies that deliver our influenza vaccines are the ones that are more likely to be associated or connected to the registry, but we've needed to add additional information around these specific vaccines. So that was one of the factors that the Pharmacy Association used in determining where vaccine was going. We also wanted to make sure that we addressed those communities that were having the highest transmission risk. So there's a whole lot of factors that went into how much vaccine went where. But then once it goes out into the pharmacies, we lose a little bit of line of sight because there's a delay for when it gets entered into our immunization system. Different pharmacies have different ways of notifying people about when they have vaccine, and so it is more complicated when we deal with pharmacies. They've been doing an amazing job and getting the vaccine to people, and as you know, there's also been changing criteria about who's eligible for vaccine. What I can say around the AstraZeneca vaccine is we don't have any indication that we're going to be receiving more in the short term. And for people who've received it already, we do have guarantees that we will get some of it to be able to provide second doses for everybody who needs them. And so that's something that we're working on with the federal government, and we have confidence in. But the other sort of complicating factor is the systems that pharmacies use to be able to provide people with AstraZeneca are not always, they take some time to connect them with our provincial registration system. So if you did get your vaccine in the pharmacy and you want to you're going to be notified about your second dose, you're very likely to be notified by both the pharmacy and the provincial system. But to make it simple, just go ahead and register in the provincial system, and that just makes it simple, and you will get a notification from our provincial system as well. So, which is all to say, none of this is simple. It takes, we're talking about 600 in some pharmacies around the province. All of them have slightly different ways of doing things. And yes, some of them have vaccines still available. It may be, well, what we do know is that in areas where there wasn't as much uptake, vaccine has been transferred to pharmacies where there is more demand. And that continues to happen, but there's very little AstraZeneca left in the province right now.
Just really briefly, Colton, about 180,000 doses of AstraZeneca have been administered through pharmacies, which I think is an extraordinary achievement. There's about 10,000 left out there that has either been administered and will be reported within 24 hours, or is still to be administered. So there is a little bit of AstraZeneca out there, but essentially, as you can tell, the pharmacies around BC have done, I think, a really good job at delivering AstraZeneca around BC to initially a limited cohort, people 55 and over, and now a slightly larger cohort. But I think they've done a very good job, and we know that they're going to continue to assist us as we move through the pandemic.